Hi, Marcia. I'm so excited to have you on.
Hi, Lindsay. I'm excited to be here.
Nice. And even if we're not, we'll fake it really well. I'm just kidding. I am excited. You made something that could be a horrific experience into a real, I hate the word journey because of The Bachelor. They're always on this journey, but it was a journey, and so I have to say it. You had a stroke and you wrote a book called Stroke Forward, which is a really good book. I highly recommend it. My favorite part about it, there's a lot of favorite parts about it, but one of my favorite parts about it is all the different voices that you hear.
Yep.
Especially, your husband, Jim, and I felt for him, and you get to sort of know your family is fleshed out. And it just seems like this fantastic, heartwarming. So when I write a book, my family hates me because I disappear into myself. My laptop never leaves my side. They hate my freaking guts. I interviewed this woman, she wrote Perfectly Hidden Depression, Margaret Robinson Rutherford, and I actually cracked up because her dedication pages to my husband, Richard, it's my turn to do the laundry. And I totally related to that because when you write a book or when you have a project or something, you're like, I don't go anywhere without my laptop, it's because there might be a free time and it becomes this very secluded and isolated event. And yours, I feel like, was so very different, and everyone contributed, and you can just feel the love, which is really fantastic. So you, on March 30th of 2014, that's when your stroke occurred.
Yeah, that was a big day.
So tell me, and also out of curiosity, what was your job before?
So I ran a marketing firm.
Okay. I don't have any follow-up questions because I'm really bad at marketing. So, but I did, at one point you did reference not returning to work. And so that was my question. So can you tell me about it? What that morning was like?
Yeah. So I woke up and I felt really funny. So I got my phone and texted my friend Michelle because we were supposed to have breakfast that day and I couldn't read the text. So I set aside the phone, I turned over and bam, I got a terrible headache, like right here. And despite the pain, I fell asleep.
Wow.
And the next time I woke up, I knew I was in real trouble because my whole right side was completely limp.
Yeah.
And so I panicked. Right.
And well, you should. Well, anyone should. Yeah.
Yeah, exactly. So I fell out of bed and I dragged myself across the carpet on the floor until I got to the door, which was closed. And so I had to reach up and grab the handle. And it was kind of hard because I was stuck to the floor so I finally got it. And I don't know how many times I tried, but it finally snuck open. And I was so tired, I just took a rest. And again, I can't tell you how long that was. And finally, I called down the hallway and I ran out of gas.
Yeah.
Completely, I just couldn't move. And I thought, well, Jim is going to come out and have a soda, right? Sometime. Crash. I don't know what crashed. But
it's
Jim
so strange that you still don't know. I was like, that you still don't know what that thing was.
So I think perhaps it was my parents.
Yeah.
Calling Jim upstairs.
Yeah. My thought is the same. And I just got the chills. My thought is some sort of divine, not godly, divine, something was looking out for you. Someone was looking out for you.
Yeah, I think so.
I do too. That's how I felt also. But so I'm glad to hear, because if you had said that you later, oh no, I figured out what it was, I was going to be super disappointed.
No, I haven't figured out what it was. So Jim came upstairs and he said, Marcia, are you okay? I went, I can't talk. So can you talk to me? I said, still not talking.
Yeah.
So he called 911 and looked around the upstairs to see if he could figure out what happened, and he couldn't. When the paramedics came, the first words out of one of their mouths was stroke.
Yeah.
When did she have her stroke? And he said, that was the first time Jim or I thought of the word. So I think that there are a lot of people out there who have strokes, don't know it.
Sure.
Or maybe I'm just.
No, I could, or TIAs, mini strokes, or yeah. I know there's some signs to look for, but that's because I watched a lot of House, the TV show. I really like that one. But yeah, it's interesting, and it's also interesting that the paramedic would say it so bluntly.
So
there's no other way to say it. Yeah.
Right. So they had to decide whether or not they were going to give me TPA, and they had to see when I had the stroke. Well, I had it during my sleep, so I don't know when it happened. My husband didn't know.
And just for people that don't know, TPA is tissue plasminogen activator. I'm totally reading out of your book, which it's a drug. It's a drug approved, FDA approved treatment for an acute ischemic stroke. To clarify that into English, it's an acute, meaning something that's recently happened, and ischemic is of unknown causes. So it's a stroke that we don't know what happened, how it came about, correct?
Right. Yes. And ischemic strokes are, they're 87% of strokes are ischemic. And that means a blood clot went into my brain. The other 13% are hemorrhagic. And that means that a blood vessel bursts in your brain and you have bleeding.
Gotcha. And you, I mean, are and were extremely fit, extremely healthy. I mean, it was not lost on me that your husband kept bringing you workout clothes to the hospital, like, you know, and frankly, in the pandemic, honestly, I haven't worn jeans. I haven't worn like yoga pants. At some point in time, I'm going to either do yoga or work out, you know? So like, I understand. I have a closet filled with, you know, workout clothes, and my husband might very well do the same thing. But the idea of a sports bra after a stroke, it was, you know, definitely.
So you could imagine putting a sports bra on when you have one side that's really not working too well.
Right. I definitely felt that. And it also, I definitely felt that. I also actually, and this is a weird thing to say, but in some way I related to that long walk, that long crawl, that long roll down the hall, because when I was 17, I herniated a disc in my back while sleeping. And I had to, like, you know, again, like I couldn't walk. And I was like sort of pushing myself on my back, like trying to get down the hall. I didn't get very far, but, you know, at some point, fortunately, my mom came in, but much less dramatic. But at the time I was scared to death. I had no idea what had happened. And there was no way of getting help because I had gotten my phone taken out of my room the night before. I had this method to stay on the phone late with my boyfriend. I unplugged the phone in my parents' room so the light wouldn't light up, so I think that I was on the phone. But they caught me somehow. So anyways, the point is I definitely felt emotional with that, because I've tried to make it down this surreal, everlasting hallway, and you made it a lot further than I did. You know,
maybe I had more internal motivation.
I think so. I mean, I didn't know what was going on, but I could speak, but you couldn't, and so I think a part of you definitely knew. Especially, I believe your mother had died of an aneurysm, or
my mother. So, and we were all surprised. So we believed that she would live to be 90 because that's what she told us. And she was saying, I want to move in with so-and-so. And it's like, okay. So when she had her aneurysm, we were just totally taken aback. It's like, okay.
Yeah.
But it never occurred to me that an aneurysm burst is a stroke.
Right. I mean, there's I think that you said there's a small difference, but it's the same equivalent. I don't know. I'm struggling with this, but yeah, but how old was your mom when she died?
77.
Okay. Right. But you were much younger. You were
53.
Thank you. I can't math. It would be a disaster if I tried. Just ask my fourth grader. They know fourth grade math is out of my realm. So it's interesting. I've never done this on a podcast, but so I'm sort of a dork for brain stuff, which is why I was interested. And there's two areas of the brain. There's many areas of the brain, but the two in particular that are interesting when you're dealing with like speech is Wernicke's area, which is in the back middle of the brain, and then Broca's area. And Broca, and especially when you pointed to your head and said that that's where the pain was, I thought, okay, that makes sense. It was obviously closer in some way to Broca's area, where Broca's area, you have trouble producing language. And then Wernicke's area, I don't know if you've ever in the course of you ever had a chance to see or speak with anyone who has experienced the trauma there, but they think that they're speaking and they're not making sense.
It's total gibberish.
Right. And I mean, when I teach a course, I show people and everyone's fascinated, but it's a really, it's frightening that our simple things can be, taken away from us like that. Yeah. And so, as a result, of your stroke, it was, I don't know if it was exactly Broca's area, but clearly it was the production that was the aphasia that was, aphasia is an inability to speak.
Right.
I'm see, you and I are well versed in some of this, and but the average listener may not be. So that's why I'm trying to do both. So one of the things that you really stress in your book, and I imagine one of the reasons why you are becoming or have become a health and life coach, is because of this experience. You've learned how important it is to really have a patient advocate. Like and it's so different than having it's not just about having a spouse or a loved one. It's about that word advocate and someone to take notes and someone to remember, because you are not going to remember. I mean,
yeah, exactly.
Especially in this instance, but also in general, when everything's going on, it's very confusing, when my husband had a health issue a few years ago, and I wrote I had a notebook. I have all the test reports. I have everything, every appointment. And I put it away. And if it comes up again, I'll have it then too. But it's someone to be there and listen and to hear what you may not be able to, especially because you couldn't speak. So. Yeah,
well, exactly. But also somebody who says, I'm not sure what you're suggesting is right for my wife. Right. Or my husband or whoever.
Right. And say a little more about that, because at what point was there? I mean, there are several points, but like, what are you thinking in particular where?
So the first time my husband noted something was the day I was rolled into my hospital room, and the nurse took me off the wheelchair and put me on the toilet and went to make my bed. So I don't think that anyone who has had a stroke should be left alone in the hospital, in the bathroom. So clearly the normal thing happened. I fell off the toilet.
Yeah.
And my husband goes, that is the only time she's going to be in there alone. I will be sure that either I or the nurse is in there every time. Right.
Yeah, I mean, the fault was the nurses, clearly, and
right.
Human errors happen. But still, there needs to be someone pushing these things.
Right. And then the second time I remember quite well is because I was still in the hospital and they had given me fluids, and I'm going to say thick fluids to drink instead of food because I had trouble swallowing. And so 65% of people have trouble swallowing when they have a stroke. So I drank the fluid by looking forward, taking a small sip, turning to the left, swallowing, and then turning to forward again.
And the reason you turned to the left was because the stroke had affected the right side of your body.
Correct. And you have to realize that when a muscle is paralyzed, it's paralyzed all the way through. So I had no movement on the right side of my body.
You know what? I'm glad you clarified that because I didn't understand. I believed your 65% statistic. I read about it and I took it, but I didn't understand until just now when you pointed out that like when it's your whole muscle that's paralyzed, it's, you know, it's your throat is a muscle, or there's muscles in your throat. And
right.
So that makes a lot of sense. Yeah.
So the kitchen sent chicken up to me. And I was going, woohoo,
Sure.
chicken. It smelled really good. And I took a bite and choked. So when you have this 65% of people not swallowing, it means that your cough sensor is off. So if it goes down the wrong pipe, they have no way of knowing
Sure.
that it's gone down into your lungs. So you can get pneumonia. You can actually die from this. And my husband stood there and realized when they were yelling at me, get it out, that I could die simply from eating.
Yeah. I mean, it must have been
Horrifying to him.
Yeah, I can't imagine, and feel so powerless at that moment to help you.
Yep. Yep.
Yeah. It's, you know, reading your story I didn't, you know, you forget how all of the pieces move together. I mean, you know, okay, so clearly it was like a Broca's area-esque left side of the brain, which is why the right side is you know, experiencing paralysis. And that's great as a dorky, you know, science girl, but like, you know, going through it and sort of watching or reading about your recovery and the way you explain it from all these different angles. And then you also get the same way you're depositing facts here as we speak, like you do the same thing in the book, you know? And it's very interesting. And it's like aphasia. So you said at one point you had to do puzzles with Jim, and Jim would ask questions like, who flies planes? Who puts out fires? Who delivers mail? And like, it's interesting because it is difficult, you know, or I'm a huge fan of Oliver Sacks. He was a neurologist. He wrote a ton of fascinating books. And then, you know, he describes it as, you know, you might know the name for an umbrella, but you can't find the words to describe what it's used for, you know, or like there's all these little intricacies. And so these puzzles were ways of increasing your, you know, what you said in the book is like, you want to do this as soon as possible. You know, you immediately go to work and you start trying to repair the damage that's been done, or really to probably build new neural pathways in the brain that get around the ones that might have been traumatized or
I like to say they're just dead.
Okay.
So I have a spot in my head that's just dead.
Okay. And so, which makes it all the more amazing the way you've learned to, I mean, work around it. I mean, you know,
it's a miracle, actually.
It's a miracle. It's a very strong, determined person and family, and you know, with a lot of support behind you. It's you tried out pretty much anything and everything. you went to a chiropractor, which I'm a little hesitant about chiropractors, but fine.
I went to 3.
Yes, you went to 3, right?
Yeah.
You did, I think you did neurofeedback, right?
Yep.
And can you tell our listeners what neurofeedback was and how it helped you?
Okay, so neurofeedback is a very small machine. It's about about the size of a smartphone. It's a little bit bigger, and it's connected to a computer, and it's got 5 electrodes on it that the doctor puts on your head, and he uses really sticky stuff that I like to call cat spit.
Okay.
So it's wet, it's gooky, it's got a little bit of it's a little bit yeah, it's just I call it cat spit because that's kind of what it reminds me of. So there's 2 positive, 2 negatives in a ground that he affixes to your head, and he turns the neurofeedback machine on. And this time it's microcurrent neurofeedback, and that's important because most of the time when you hear about neurofeedback, you have to look at a ball or something else on the screen and make it move, right?
Okay.
This is non-operant neurofeedback, means that you do nothing. So you just sit there, and I didn't feel anything. Now I could see my brain waves going across the screen, but I couldn't feel a thing. I'm going, is he really doing anything? Right? So when I went home, I noticed that I could actually speak better that day. I went, okay, there's something to this. So it uses 1/100th of a AAA battery and pings your brain. And by doing that, it unlocks or breaks your brain out of this pattern that it's in. And apparently, after 16 sessions, I was broken free of probably PTSD, post-traumatic. Yeah, thank you very much. I don't know why I always have trouble saying that, but and I had 2 parts of my brain. So somebody always talked to me and I could understand them. I knew what I wanted to say, but I couldn't say it. So I thought of something different to say, and sometimes I could say it, sometimes I couldn't get anything out. But those 2 pieces of me came together. So I was actually speaking as one person rather than having another voice in my head.
That's interesting. I mean, I don't understand neurofeedback to understand how it could work. I also don't, like, I'm not denying it. I'm just saying I don't, and I also don't, I don't know enough about it. And I also don't know how the passage of time, affects, if would have affected. I don't care. It helped you get better, and so like, that's great. And I think I would want myself and or any loved one to try anything and everything. And neurofeedback is, I mean, it's established. It's, it's something that is done. It's not like a quack science. It's, anyone who's interested, sometimes people with anxiety or depression or whatever it is, they give it a try. And I don't know how it works, but maybe it is helping with our, to develop new neural pathways or new, I don't know. I mean, everything requires a battery or a charge. Maybe we do too sometimes.
Yeah, exactly. So the interesting thing is that, so if you are thinking about neuroplasticity, right? And you are going down a path that hasn't been trod down before. You get out your machete and you carve a little path. And if you carve that path every single day, you get a new furrow in there,
sure.
Right? So that's part of what I was thinking about this, is that I tried speaking every day, but I didn't have a pathway to follow. This helped me carve a new path.
That makes a ton of sense. It's the like you were just sitting there passive in theory. And yet somehow the brain knew where it needed to go or where the path needed to, like that's the part that I don't yet understand. Also not a neurologist, so, but
nor am I.
right. But, but I mean, you obviously looked into this a lot and it helped. And also, I actually have patients that did do electroshock therapy several years ago, and it did help. I mean, there's a lot of downsides, and this is not the same, except it involves a small amount of electricity. But electroshock therapy, it gets a bad rap, but it can be used to maybe to carve a new path or to break through severe depression or a bipolar issue. So this is just a slight variation in something that psychologists have been using for quite some time,
Right.
Which makes sense.
Mm-hmm.
And do you think, was the neurofeedback like the turning point, or?
Oh, that was definitely the turning point for me getting my speech back.
Okay.
So after 16 sessions, I talk like I do now.
That's amazing.
So beforehand, so if we had this podcast before I had neurofeedback and you called me up, I might not have said anything. You could just be looking at me and, that's fine. But I enjoy being able to speak freely rather than just think about what I want to say.
I mean, I started this podcast because I felt like my voice was silenced a lot when I was younger. And so I fell in love with podcasting because this is my chance to be heard and to speak my truth and to, meet fascinating people and share their stories. And so this podcast feels like it gives me power. It's a false sense of power, but it's power. And I can't imagine, not being able to speak. And because also, if I could write, it would be slightly better. But for a while, I mean, you had it's problems communicating, it's problems in language production that includes writing or texting or so I imagine, I don't know how you stayed I'm going to say sane. I don't mean that literally, but how you didn't sort of want to crumble.
Yeah. So first off, I want to say that it is power that you have, and you should be. The power is you're sharing what you think with so many people.
That's true.
And it's not false; it's positive.
Well,
so you just need to be aware that without your help and encouragement, nobody out there would know what's going on with all the people that you interview.
Which is true. And I also make a point about talking a lot about subjects that people aren't comfortable talking about, and in this case, in your case with the stroke, I think there's just not a lot known about it. I mean, there is in the medical field, but in the everyday person, I feel like doesn't necessarily know these things, like the way the paramedics came in and knew immediately. So but so thank you. And also, like, I hope that this is doing good for other people also. And I know that you have the same hope, and that's why you're going to become like a health and life coach, an advocate. So how long were you? Well, you went home after about 2 weeks, and then it was all outpatient?
No, so I went home from the rehab hospital. I was in that rehab hospital for 2 weeks.
Right.
And then I had 6 weeks of home health care.
Okay. Yep.
And then I had 2 weeks off. And then I had 8 weeks of outpatient care. And they said, okay, you're done. And I went, I am not done.
Right.
So, okay, so realized, looking at how a person walks, yeah, I could walk kind of, but if you think about all the muscles involved, all the ligaments, everything else, and when you're walking as well, you move your arm and hand. So I really wasn't moving them. So I had a physical therapist that I hired and I worked with her for a year.
Yeah, I mean, something that struck with me. Apparently, I can't speak today. Great. This is gonna be great. We'll both just sit there. One of the where you said like the pain's still there, even if I'm not walking differently, because you said it's always painful, it's easy to, of course, I have so many underlines, I can't find it. But I mean, but the point was like, you were still in pain, even when you were, like, it's one of these things that people think, oh, you look good, you're walking better, and they don't think, but you're still in pain.
Right.
And it's true, the muscles have to work different, and it takes time, and good for you for the, for hiring a physical therapist. I have a love-hate relationship with physical therapists because of my extensive history of back issues, but they become your best friends, like it ends up being your full-time job. I've herniated 3 discs, and it becomes,
Ooh.
yeah, I'm really good at that. Yeah. I'm very good at herniating discs. So
that would be something I wouldn't be proud of.
I'm not. I also broke my foot running, and so then that had to be surgery. So I hang out a lot with the physical therapy people.
Yeah, it sounds like it.
Yeah. But it's funny. I have to tell you this story because you talk about the fact that not every doctor is for you, and not everyone's a match, and there's some that you had great matches with and some that you didn't. And I need to share a story because this is a fantastic story, and I feel like you'll appreciate it. So I injured my arm playing pool volleyball with my 10 and 12-year-olds. It's embarrassing. I don't know what happened, but it's apparently like a tendon tennis elbow type thing. But it's been like 6 or 7 weeks, and it's not getting better, and it hurts like hell, and I can't pick things up and whatnot. And so I finally made an appointment to see an orthopedist because you had to. And I walked in, and I was like, I filled out all the paperwork, like describing where the pain is. I know the bones, I know that, and I said, yeah, I'd like x-ray, shot of cortisone, and a script for an MRI, because I've done this before, so this is always the order. Not this body part, but every other body part. And
right.
So the guy was really an ass. And he actually said, like, sorry, it's been a busy day, but he didn't stop being an ass. And like, he just was very much like, he'd do these exercises, and like all my patients, they'll say, oh, I did them, but then when I asked them to show me them, they're not doing them right. And he like literally had me like do them. And then, and he didn't like the cuff I had. So he told me to get another one, and then we'll make an appointment for a month. And, but if in 2 weeks you're feeling better, you'll be fine. But if you're not, it's because you're not doing the exercises right. 65% of people who don't get better in 2 months end up having surgery. And of those, only 40% feel any relief. I was like,
okay.
Right. So I was very displeased with my interaction with this man, and kind of bummed and frustrated, and like, but he gave me the shot of cortisone, and I had to ice, and I've been doing these exercises the right way because screw him. I'm not going to, like do it the wrong way. Right. This was last Wednesday. And then Sunday, my son had a play date. I went to go pick up this other kid. I left my daughter home, and I came back, and there's groceries in the house. And I was like, what's this? And she said, ShopRite just delivered us groceries. And I said, we didn't order any groceries. And I take a look at the receipt, and it's the right number of my house, but the wrong street. And my daughter, of course, accepted it because she didn't know. And so I'm like, okay, I'll be right back. And I put the groceries in the car. It's half a block away, so I put the groceries in the car and I drive over to this house and I knock on the door. It's the doctor's house.
Really?
Yes. And I was like, I just saw you. And I actually, had I had another minute, I probably would have told him that he wasn't very nice, but like, it was so surreal and so weird. And I was just like, this is very bizarre. Like I was, and so it was just a funny coincidence of this man living right down the street and obviously didn't look at my chart enough to even register like the address or anything. Like he didn't, any medications, like I don't know what he looked at, So if I ever had surgery, it would not be for him. And now I know I can go at his house sometimes. So I won't, but it's a weird story, right?
Yeah, it is weird.
So what kind of doctors did you find that you did connect with or didn't, or,
So I found that I connected with those that are more holistic. And I didn't connect with, so there was the neurologist that was treating me in the hospital. And so I made an appointment to follow up with him, a few appointments actually. And we didn't get along. So I just stopped seeing him.
Yeah.
And eventually I heard of another neurologist through my stroke group. She was fantastic. She just was the best. Woohoo! I was happy.
Good.
And then she moved.
Bad. Sorry.
Yeah. It was good for a year or so. And then I found another one again through my friends. I found another one. So this is what I think I learned the most. Just get down. Sorry, the cat is going after the food.
It's the cat. It's okay. I have two. And I figured it was the cat.
So your friends are great for recommending other people.
Yeah.
Yeah.
Yeah. No, that's fantastic advice. I have to tell you, there's two other things I loved, and one is driving topless. That was fantastic. I don't think we should explain it. I think people have to buy the book to understand.
Okay.
So if you want to know about Marcia driving topless, buy the book, Stroke Forward. Where can they find it?
Oh, they can find it on Amazon.com.
Of course, everything's on Amazon. And then the other thing that I thought was really interesting was Toastmasters. So that's it's an educational organization that teaches public speaking. I obviously need it, and leadership skills. And so I guess you joined as a way to further recover and practice and put yourself out there.
Yep.
It must have been really scary.
It was. So the first time I spoke, so I started Toastmasters in 2016. So I was right in my aphasia. And I didn't speak. So finally, my friend Donna said, you have to give a speech. It was 7 months and I went, okay. So I went home and I practiced. And I actually practiced enough so that I could do the speech. I was so happy, right? So I remember driving in and I was still practicing my speech. And we were in the Toastmasters room and I had one speech go before mine. So I was still practicing, but I didn't know if I'd be able to speak. So she called me up to the head of the table and I got my laptop and everything fixed. So if I didn't speak, I at least had something to show them. So I had slides.
Yep.
Right. So I said the first sentence of my speech and woohoo, it's going to go well. I couldn't say the second sentence. I started it and halfway through I just shut down. I couldn't say it. I tried 6 times. And on the 6th time, I actually said it. I finished the speech and sat down. And I was really excited and proud of myself because I got through the speech. I didn't let circumstances get me down.
No, and you kept trying, which is the most, fall 7, get up 8. I mean, that's, or we like to quote Batman in my house. Why do we fall down so we can get back up again? But what a huge, accomplishment that was. What was the speech about?
It was an icebreaker, so it was about my life.
Okay. See, that should be easy, except for one thing, aphasia. So, yeah.
So most people are afraid of standing in front of people. That wasn't what I was afraid of. I was afraid of myself. How would I get the words out?
But so in your case, it's a valid fear, some people, it's like a, naked in front of a classroom, type fear. But in your case, this is valid. But I think that, and I think you think that pushing yourself to do these things is what did make you progress. Like, had you relied just on conventional measurements,
I'd like to say I would be stuck at home thinking about things, but not saying things. Probably, I think that people with aphasia often feel hurt by society because they're thinking like a normal person thinks, but they just can't communicate.
Yeah, I didn't think of it that way, but it's true. It's interesting because society is not doing anything hurtful, but you're alone and isolated and stuck in your head. And that's, it's got to feel awful and paralyzing.
Yeah. So every time you have aphasia, a little bit of you goes away. And think about that happening year after year after year.
Right.
At least that was my experience. Sure.
Right. And, even as we're speaking and I'll sort of stumble or pause for a word, it's not a permanent. I know my brain will catch up to my mouth at some point. Usually my mouth moves much faster than my brain. So lots of regrets, but
that's normal.
Yeah. Well, also, insensitive, and sometimes I, speak without thinking. And sometimes I actually deliberately plan to say bad words in public just to, jar someone out of their position. But, it does feel, I do get the description of feeling sort of shunned by society or lonely or isolated, or I would go with hopeless and helpless also, and you took the opposite route and, you had great support. You used every contact you had, and you really reached out, and you are kind of a rock star. I
don't know if I'd say that.
Well, I would. It's my sort of language, but I don't know how is your right side of your body now? Do you still have that sort of weakness and
yeah. So I'm 95% better. So I'm still a little weaker on the right. So I notice that I do a lot more things with my left hand than I do with my right, but I do say, okay, you're reaching up, you have to use the right hand. And I have full motion, right?
I noticed, yeah.
But I still have some pain. It's not a lot of pain, and I ignore it. Yeah. And if I'm outside walking, I'm I'm walking well, but I still notice that it's weaker than the left hand
Okay.
side. Yeah.
You know, just one more quick note, because I love that we both agreed on that was some sort of, you know, someone looking out for you with that thing that crashed. And there's something else I forgot to mention. Well, two things. Well, one is you broke your right hand when you were in, I think it was 10th grade, correct?
No, I dislocated my right elbow.
I'm sorry.
Okay.
You dislocated your right elbow. And so in order to keep up with school, you learned to write with your left hand.
Yep.
So, which is another one of those like fortuitous, you know, weird fortuitous things. I mean, it had to be, if you asked me to write with my left hand, I mean, well, my left hand's also the messed up one now, but like, I can't do it. And my right hand now looks like scribble scratch anyway, because how often do we actually write? But
Right.
it just feels like your recovery, I hate the word journey, but it is, but your recovery was really a combination of like someone looking out for you and your own inner strength. And it's so inspiring. And really, I strongly encourage all of my listeners to, you know, buy Marcia's book. It's again called Stroke Forward: How to Become Your Own Healthcare Advocate, One Step at a Time. Is this actually you standing on a mountain?
No.
Thank God. Okay. Because that looks dangerous.
But if I had before the stroke, that totally would have been me.
Well, then that would have been dangerous. I am just glad that is not you standing on that mountain, because this gives me a lot of agita and anxiety, but it's a fantastic book. And Marcia, thank you so much for agreeing to meet with me.
Thank you so much, Lindy.